Hello, everyone, and thank you for joining me. I'm Jessica with Nexus Youth and Family Services. I can't believe it's June already, but here we are. This month, we are going to be talking about living well with chronic pain. The learning objectives for this video is the chronic pain cycle, long-term effects of chronic pain on mental health, how to identify the warning signs, and strategies to living well with chronic pain. Acute pain is caused by a specific disease or injury and is short-lived. It serves a biological purpose in alerting you to actual or potential tissue damage, such as breaking your ankle. However, on the other hand, chronic pain is often considered a disease state where the brain has become hypersensitive to even a slight touch or movement. It is typically persists past the time of expected normal healing, like 3 to 6 months. Can also progress from and form a psychological state. In these instances, pain does not necessarily mean damage. Following the expected healing time of tissue, chronic pain can proliferate through psychological and neural pathways. After healing of an injury, the brain can learn to be in pain. Any sensation or movement from the previously injured area can cause anxiety, but these sensations are causing damage to the body tissue. The brain then becomes hyper aware of this area, and the changes in the neural brain pathways can occur that cause the brain to interpret more pain, even in the absence of an unpleasant sensation. More pain causes further anxiety and less movement, like progressive deconditioning, leaning to further detrimental nervous system changes, and short pathways in the brain can rewire to become more sensitive to sensation and movement. All of this is how the cycle of pain starts. Knowledge. Understanding the pain doesn't always mean damage, and structural abnormalities are not always matched to the pain intensity. For example, a herniated disc can be painless. Recognize that fears, misconceptions, and anxiety about pain may be making the problems worse. Movement. Yes, we are talking about physical therapy. Physical therapy has a very active role in breaking the pain cycle and cannot be emphasized enough. Avoiding physical activity can cause muscles to weaken and neural pathways to maladapt. A physical training or physical therapy can introduce and encourage safe movements that, if kept up with, can strengthen the surrounding muscles and rewire the brain into understanding that movement and other sensations do not equal pain or damage. Exercise is the key to revising deep-rooted chronic pain. Then there's therapy, like cognitive behavioral therapy, which is aimed to change maladaptive thoughts or behaviors. There's meditation, stress reduction, adequate sleep, and more can be helpful in rewiring the brain and breaking the chronic pain cycle. Long-term effects of chronic pain on your mental health. If a person in pain continues to miss out on opportunities to connect with others due to pain, such as visiting with friends, they may think that they are controlling their pain by staying home, yet the pain still remains. That doesn't change. Days, weeks, months, and years go by, and the pain is still there. However, now they have the burden of a life that isn't fulfilling, especially if we don't engage with things that we care about. It becomes a battle of balance, trying to control pain versus truly living. In addition to medical and physical implications, chronic pain can have far-reaching impacts on an individual's employment, lifestyle, and mental health. It is well documented that chronic pain is associated with an elevated risk of psychological distress. Both greater pain intensity, such as how much pain is you experiencing, and pain interference, such as the impact of the pain on your daily functioning, have been independently associated with elevated depressive symptoms and lower mental well-being in pain populations. Does chronic pain cause brain fog? Guess what? It does. Chronic pain often causes mental and cognitive symptoms such as a short-term memory loss, difficulty processing information, confusion, and trouble focusing. These symptoms are commonly known in the pain community as brain fog. Lots of people believe that brain fog is also stemming from their medications, but the brain fog is still there due to chronic pain. Work, school, and other daily tasks can be challenging when dealing with brain fog, which can lower a person's self-esteem. When they start to feel as though they cannot function as they once did, not only physically but mentally, it starts to create this lower thought of themselves, which can slowly slide them into depression. An estimated of 35 to 45% of people living with chronic pain also experience depression, and lower self-esteem stems from the inability to function. Chronic pain can prevent the participation in social activities or hobbies that were once enjoyed. Family members or friends may not understand the chronic pain condition, and they may distance themselves as a result. Individuals with chronic pain may find that they need to frequently cancel plans due to unexpected fatigue or high pain levels. People who live with chronic pain are also at an increased risk of experiencing mental health concerns, such as depression and anxiety. This typically reduces the desire to interact with others or maintain relationships. This also can interact with those who are closest to you and your concerns for them. It can also distance you with family who doesn't quite get what you're going through and doesn't understand, because maybe on the outside you look really healthy and look fine, but really on the inside you're suffering from all this pain and they don't understand the condition, so they slowly push away. Loneliness has a substantial influence on an individual's health and well-being. This is especially true for those with chronic pain conditions. Loneliness can interfere with sleep, which is necessary when dealing with chronic pain. It also contributes to chronic inflammation, which can exacerbate our pain. Lonely individuals are less likely to participate in healthy habits, such as eating a balanced diet or being physically active or prioritizing sleep. They may attempt to cope by turning to alcohol and cigarettes or drugs, which causes negative impacts to chronic pain and overall health. According to the American Psychology Association, people living with chronic pain are at a heightened risk for mental health problems, including depression, anxiety, and substance use disorders. Chronic pain can affect sleep, increase stress levels, and contribute to depression. An estimated 35 to 45% of people with chronic pain experience depression. Pain can also become a common symptom among people with an anxiety disorder, particularly generalized anxiety. According to the Anxiety and Depression Association of America, anxiety, depression, and other mood disorders commonly occur at the same time as chronic pain from conditions like fibromyalgia, back problems, migraines, and arthritis. There are many warning signs a person may have that indicates that they need professional help. Some are having suicidal thoughts, talking about wanting to die and have a plan, giving their items away, not seeing a future, feeling hopelessness, not keeping up with basic hygiene, not engaging with friends and loved ones and starting to isolate, not finding pleasure in things you or they once used to do and find pleasure in, not feeling like yourself, and however you define that, feeling anxious most of the time, having repetitive thoughts or having racing thoughts, not being able to concentrate, feeling down or depressed, not eating enough, or eating more than you should. The best thing about mental health is that you don't need to have warning signs to benefit from it. Everyone can benefit from mental health or a mental health professional. Chronic pain is a lot like an iceberg. You have that persistent pain on top, but what people don't realize is you have all of these other symptoms underneath that can also be leading to mental health disorders or mental health problems that just need to be addressed. So please reach out and watch for those warning signs. If you do not have a psychologist or a counselor to report your concerns to, you can always go to your primary care physician. See if they can provide any referrals to a therapist. If you do not feel you're being heard at your primary care physician, or maybe you don't have one, You can visit several websites to look for a therapist. You can go to Mental Health America. You can go to Association for Contextual Behavioral Science. You can go to Psychology Today. You can reach out to your insurance company and ask for a list of therapists in your network, or you can reach out to your local county behavioral health. Now, how do we ask for help? You want to be clear and concise. When you make your appointment, write down your concerns and your symptoms prior to going. You may want to say things like, I'm sleeping less than 4 hours a night as I'm having racing thoughts. Or, I also keep shifting positions due to shooting pain. Or you may want to tell them, it's difficult for me to concentrate at work because I feel so overwhelmed most of the time. Now, what if you need immediate assistance? If you need immediate assistance and are in crisis, meaning that you are at risk for harming yourself or others, please go to your local emergency room or dial 911. You can also call or text 988 and chat at 988lifeline.org. Or for substance abuse use, you can reach out to 1-800-662-4357 to reach out to a Substance Abuse and Mental Health Services Association national hotline. It's free, confidential, 24/7 and 365. Chronic pain can impact every portion of our lives. Therefore, it's important that how we cope includes many different approaches. For example, you can do a peer-led support group. Mental health professionals lead support groups in multiple different formats, in person, virtual, even Facebook groups and online forums. They can even be very specific to fibromyalgia or a spinal cord injury or migraines. Or you can go to ones for general chronic pain. You can also look up different websites for peer support, like Mental Health America or Chronic Migraine Awareness, even the U.S. Pain Foundation. Then there's podcasts. Those are great things you can listen to. Or what if you prefer to get moving? So if you prefer movement, exercises that can really help you are yoga, tai chi, and physical therapy. Also gentle stretching, and even times of long meditation. What is important of movement is any kind of it, and that you're consistent with it. But of course, always check with your medical professional before starting any new type of movement routine. Also, don't forget, you can reach out for therapy. Reach out to someone that you can talk to about how to get help with your chronic pain and your mental health. Healing through mindfulness. What does that mean? Mindfulness means paying attention on purpose in the present moment and without judgment. But how does that help us heal through pain? It changes our brain structure. MRI scans show that after an 8-week course of mindfulness practice, the brain's fight or flight center changes. It shrinks down. This primal region of the brain is associated with fear and emotion. It is involved in the initiation of the body's response to stress. As the center of our brain that has our fight or flight starts to shrink, the prefrontal cortex of our brain, associated with a higher brain function, such as awareness, concentration, and decision-making, becomes thicker and larger. The ability of this can decrease cortisol levels and increase immune function. It will increase well-being and quality of life. It can enrich relationships with self and others and the world. It also allows people in chronic pain to reignite their mind and body once again. Many people in pain feel as if their minds are separate from their bodies due to the deep sense of hatred of their body from failing them. This integration of mind and body shows you that your body is not the enemy, and to work with your body and not against it. Another option is healing through psychotherapy. What does that mean? It means you can go to individual, couples, or family therapy. That means you're going to sit there with someone who can help you, like myself, work through where the pain is affecting your life and how can you help yourself through the mental practices. The other thing you can do is you can do expressive art therapy, music and dance, movement. There's other things such as acceptance and commitment therapy. You can do dialect behavioral therapy. These types of therapy help you with other aspects such as workbooks, and mindfulness practices and exercises to reframe our cognitions that we're developing in our brain to really accept and commit and move through what we're going through, to be able to find healing with our mind and not just with medications or substances. While the chronic pain will still be there, but we can figure out a way to live with it and not just live because of it and be wrapped up in it, not just let it guide our lives. We're going to live through it and live a happy life alongside of the chronic pain instead of the chronic pain taking over. There's other places you can go to learn some more things through mental health to help you with your chronic pain. You can go to the website Phoenix Rising with Dr. G. It's What's Pain Psychologist. Then there's, again, acceptance and commitment therapy that you can actually check out at migrainedisorders.org. It's a podcast about acceptance and commitment therapy. ACT, Acceptance and Commitment Therapy. By accepting and learning to live with pain, one can limit control it exerts over his or her life. But what is the essence of that therapy? This therapy guides individuals to change their expectations from the elimination of pain to living as well as possible with pain. Through metaphors and exercises, individuals can learn the uselessness of control-oriented strategies to the benefits of acceptance-oriented strategies in response to negative internal experiences such as pain and discomfort. Individuals are encouraged to explore their personal values and set goals consistent with those values in order to improve overall quality of life and functioning. CBT, Cognitive Behavioral Therapy. Your body is aching and the pain feels unbearable. The last thing you want to hear is, it's all in your head. For people with chronic pain, the discomfort is very real, and they all know all too well that the feeling is inside their bodies. If you're lying in bed and hurting, the pain is your whole world. This is where we can enter cognitive behavioral therapy as a pain management. CBT is a form of talk therapy that helps people identify and develop skills to change negative thoughts and behaviors. CBT says that individuals, not outside situations and events, but the individual themselves, create their own experiences, pain included. And by changing their negative thoughts and behaviors, people can change their awareness of pain and develop better coping skills, even if the actual level of pain stays the same. CBT, or Cognitive Behavioral Therapy, helps provide pain relief in a few ways. First, it changes the way people view their pain. CBT can change the thoughts, emotions, and behaviors related to pain and improve coping strategies and put the discomfort at a better context. You recognize that pain interferes less with your quality of life, therefore you can function better. CBT also changes the physical response in the brain that makes pain worse. Pain causes stress, and stress affects pain control chemicals in the brain, such as serotonin. CBT reduces the arousal that impacts these chemicals. This effect may make the body's natural pain relief response more powerful. That's how we can involve CBT. CBT is a great pain management system that you can use. You can see below a pain management workbook that you can actually work through yourself, but please make sure to reach out to a professional before you do. Inflammation has a good guy and bad guy role in your health. When you're injured or get an infection, your body signals the immune system to send white blood cells to the affected areas to repair the injury or fight the infection. However, when the injury heals or the infection goes away, inflammation normally goes away too. However, sometimes your immune system gets turned on and it stays on after the crisis has passed. Over time, this can damage healthy cells and organs and cause consistent pain in the muscles, tissues, and joints. Chronic inflammation can also raise your risk for heart disease, diabetes, certain cancers, and even Alzheimer's disease. Your diet can help support your immune system by having it turn on and off at the appropriate times. However, a poor diet can alter your immune system, so it acts abnormally and can contribute to persistent low-grade inflammation, which can increase your pain. The strongest scientific evidence suggests foods rich in antioxidants can have an anti-inflammatory effect that helps soothe and prevent painful flare-ups. These foods include many of the staples of the Mediterranean diet, such as whole fruits, dark greens, nuts, and whole grains. In order to figure out a proper diet, please reach out to your primary care physician or reach out to a nutritionist to see what kind of diet you might need. Self-care in a flare. When you're in a lot of pain, doing something that helps your body, mind, and soul can really feel good. Something that can lessen the heightened, intense pain that you're feeling in that moment. Self-care is not selfish, and it's very important to do it. Determine if you can tell which conditions or symptoms are in that flare. Sometimes we will not be able to tell which condition is flaring, and that's okay, but we can still help ourselves out. Pace if you need to, rest if you need to, reach out for support if you need to. Remind yourself that flares pass and emotions come and go. Using your coping skills like grounding or breathing or mindfulness can also help. So please remember that self-care is not selfish, and it's important for you to do something. Maybe it's soaking in a warm bath. Maybe it's going outside and breathing in fresh air. Whatever you can do in that moment to reduce that pain during that flare, that's important self-care that you need to do. Here are some resources and some websites that you can reach out to aside from the resources we've already been discussing. You can go to Mental Health America for an open podcast about pain. You can also look up Association of Migraine Disorders or the U.S. Pain Foundation. There's also the International Pain Foundation. And you can even go to California Department of Public Health and look up their chronic pain section on resources for yourself. Thank you so much for joining me and watching this video. I really hope that you found something that can help you with your chronic pain that you may be suffering, or a loved one who is suffering from chronic pain. Chronic pain can impact anyone from 9 to 90. It doesn't matter. It's very real and it affects everyone's lives, from the person suffering from chronic pain to the people around them who love them and are caring for them. So I hoped we were able to help you find some resources for alternative ways to help manage that chronic pain. As always, please subscribe, like, and comment, and subscribe to our YouTube channel to see more of our videos. Also, please let us know how we're doing and what we can do to support you more. Thank you so much, and I look forward to seeing you next time.